I am now delighted to welcome our first research presenter, Dr. Reshmi Nair. Dr. Nair is one of our own. She is the data scientist at the Moore Center, and she's an assistant scientist in the Department of Mental Health here at the Bloomberg School of Public Health. She and I have collaborated for the past 2 years, and hopefully for many years to come, on all of our Moore Center research projects. Her primary research goals are directed towards managing, designing, and analyzing research studies in collaboration with public health policy analysts and developing statistical methodologies for modeling public health and criminal justice data. At the Moore Center, she provides statistical support to facilitate the data management, statistical design, execution, and analysis of prevention-focused public health studies. Please join me in welcoming Dr. Nair to the podium. Hopefully you'll do a better job than me.
Well, good morning, everybody, and thank you so much, Elizabeth. I would like to start by saying that it is wonderful to be part of the team at Moore Center. Working with people who are enthusiastic, dedicated, hardworking, and passionate about what they're doing is very, very motivational. So the core focus of all projects at the Moore Center are focused and targeted towards child sexual abuse in terms of policy evaluations and program interventions. And I'm really excited and thankful today for this opportunity to share with you the overview of a project that is in collaboration with the CDC, in which we are studying the impacts of Medicaid expansion on the prevention of child abuse and neglect, and other types of violence which are interlinked with it. So I'd like to begin by briefly describing the public health approach to violence prevention. The public health approach seeks to protect and improve the health of people and communities. So we start by asking the fundamental question, where does the problem begin, and how can we prevent it from occurring in the first place? And to answer these questions, we use systematic and scientific approach to understanding the problem. There are multiple steps that are involved in the public health approach. Many people and many organizations are involved in every step. So we start out by first defining the problem. We then identify the factors that increase the susceptibility of the problem, and these are called risk factors. We also identify the factors that decrease the susceptibility of the problem, and these are called protective factors. And once we've identified the risk and protective factors, that understanding helps us to develop targeted interventions for the high-risk population. And finally, we are able to implement the interventions that have proven to be effective or are highly likely to be effective. And after we've implemented, it is really important to collect data and evaluate the effectiveness at the larger level and determine the cost effectiveness so that we can balance the cost of programs and help policymakers determine the optimal public health practice. Although this representation here shows a linear progression, as we know in reality, many of these things happen simultaneously. And prevention is at the forefront of all the efforts, and the overall success depends upon everyone who is involved in this process. So the problem that we are looking at is the issue of child abuse and neglect. This includes physical abuse, sexual abuse, emotional and psychological abuse, and deprivation and neglect. So we ask the question, is child abuse and neglect a public health problem? And the answer, unfortunately, is yes. Firstly, because it is quite common. According to a recent meta-analysis study, globally more than 1 billion children, that is half of the world's children, are victims of violence every year. If you look up the World Health Organization's website, they say that the international studies reveal a quarter of adults were physically abused as children, 1 in 5 women and 1 in 13 men were sexually abused as a child. Here in the US, although we have seen that there are sizable declines in all forms of violence since the 1990s, but the numbers for child abuse and neglect are still high. These are the figures from the recent 2017 child maltreatment report. You can see that there was, over the period of 5 years from 2013 till 2017, there was a 10% increase in the number of children who received a response from the protective services or an alternative response. The number of victims also increased by 2.7% over this 5-year period. Majority of the victims were neglected. More than 18% were physically abused, and more than 8.5% were sexually abused. Much of child abuse and neglect is not visible because it takes place in the privacy of domestic life. And however, it is widely prevalent in all societies. Child abuse and neglect exerts a long-term impact on the child's neurological, cognitive, and emotional development. Many consequences are not apparent until years later after the exposure. The lifelong negative health consequences include high-risk sexual behavior, mental health problems, drug and alcohol misuse, and other major consequences that lead to disease, death, and disability. Maltreated children are themselves at an increased risk of perpetrating and becoming victims of multiple forms of violence, which include sexual violence, youth violence, intimate partner violence. And these all violences are interlinked because they co-occur within the family. And prior victimization substantially increases the risk of subsequent violence perpetration and re-victimization. Given the vast range of health and social consequences of child abuse and neglect, it is not surprising that the costs are enormously high, both for the child and family and for the society. Recent research has shown that costs associated with consequences of violence against children exceeds $120 billion in the US. A study that Dr. Letourneau led showed that the estimated average lifetime cost for child sexual abuse in the US was over $9 billion. Hence, child abuse and neglect is recognized internationally as a serious public health issue. The issue of child abuse and neglect is very complex. To understand and deal effectively, we need to analyze the interactions of a number of factors in our ecological model, starting from the individual level to the relationship factors where we build relationships with families, friends, peers, and others, to the community level where these relationships build, like neighborhoods, schools, and in the underlying society at large. At the individual level, risk factors include risk factors for parents and caregivers. These could be because of lack of awareness of parents about child development. They could include unrealistic expectations, not understanding the needs of the child and the behavior, approving of punishment as a means of disciplining the child, drug and alcohol misuse by the parents and caregivers, and their underlying depression. Saying that certain factors are related with the child does not mean that the child is responsible for it. It rather means that it may be more difficult to parent children with these factors. This includes children with mental and physical disabilities. Risk factors at the relationship level include family breakdowns, disrespectful relationships between the family. There could be violence between the parents or the parents and children. And there could be other factors. At the community level, this could include high levels of unemployment, easy availability of drugs and alcohol. There could be tolerance of violence within the community itself. At the societal level, There could be policies that lead to poor living conditions and socioeconomic inequalities. There could be rigid gender roles. There could be glorification of violence as okay towards others, existence of child labor. All of these risk factors lie within the larger society. When it comes to protective factors, most of the research has focused on lessening the impact of child maltreatment on the child victim. This includes good parenting skills, non-physical disciplining techniques, strengthening the bond between the child and the parent. Although it is critical to address factors at all levels, bulk of the violence prevention has focused on individual and relationship level. Little is known about the factors that protect families and children against new instances of child maltreatment. And evidence base at the community and societal level is very limited. This is a critical gap for the violence prevention field. Why it is important to focus on the community and societal levels can be explained from this 5-tier pyramid of prevention. So this represents the influence that may result from public health interventions. The top-tier interventions like counseling and education, clinical interventions, are targeted towards individuals and not towards the entire population. And even the best programs at these levels achieve limited public health impact because they depend a lot on long-term individual efforts. Lower tiers of the interventions are more effective because they reach a broader segment of the society and require less effort at the individual level. As per the public health approach, there is a strong conviction that child abuse and neglect is preventable. For this change to occur, we need to not only change individual knowledge, but we also need to change the social environment. There is no single solution to this problem. Multiple complementary activities are required at all levels. Given that there is limited research evidence of effective policies on primary prevention of violence that affects children, families, and youth, the CDC's National Center for Injury Prevention and Control has been supporting comprehensive prevention research that funds studies that conduct rigorous evaluation of policy strategies for their impact on violence prevention. So last year, we had the opportunity to apply for one of these proposals that would look at evaluating the impact of Medicaid expansion policy. The evaluation of public policies has shown to be associated with positive impacts on child and youth health. And unfortunately, violence affects individuals and families in the low-income communities disproportionately. We believe that Medicaid expansion policy has the ability to impact key risk factors for children and their families who reside in low-income communities. Prior to the Affordable Care Act, Medicaid was predominantly covering low-income children, pregnant women, and individuals with disabilities. The 2010 Affordable Care Act expanded Medicaid to low-income, non-elderly adults, which included parents. 24 states and the District of Columbia expanded Medicaid on the earliest possible date, that was January 1st, 2014. Since then, a dozen states have adopted Medicaid, and the Medicaid is required to cover essential health benefits for expansion population, and the services are thus consistent over all the states. Although Medicaid expansion was not intended to exert effects on violence, yet we believe there are strong reasons that it might. And we have a three-step approach in terms of theory. So We believe that Medicaid expansion, and we believe this based on a number of studies that we have seen, shows that Medicaid expansion increases the insurance coverage for low-income population. It increases the access to services of mental health and substance use disorders, and it reduces out-of-pocket expenses and medical debt. Benefit of insurance coverage, access to care, and reduced medical debt are all associated with improvements in the mental health condition, reduction in substance misuse, and improvement in financial stability. And 3 major risk factors that are associated with increased risk of child abuse and neglect are parental depression, parental substance misuse, and family financial problems. So we believe that improving these factors would make an effect on reducing the violence on these factors. So in this grant, in addition to child abuse and neglect, we also are evaluating the impact on youth violence and intimate partner violence. And these violence are all interlinked. And so we believe that if Medicaid expansion is associated with reductions in one type, that we would expect to see reductions in other types of violence as well. So our hypothesis is that we hypothesize that relative to states that did not expand, expansion states will have significantly reduced rates of reported and substantiated child maltreatment incidents during the post-implementation period as compared to the pre-implementation period, that is post-2014 compared to pre-2014. The primary data that we are using for this study is the National Child Abuse and Neglect Data System, which is the individual level de-identified records of every report of suspected maltreatment in the US. It's collected by the Children's Bureau. It has information about the child victim. It has information about the incident, the maltreatment, the disposition along with it, which state and county reported it. There are also information about caregivers and some information about the perpetrator, but for this study, we are focusing on the individual and the incident characteristics. Our primary outcomes are rates of reported incidents and rates of substantiated cases. We are looking at 2 groups. So we have the intervention group, which consists of the early adopters of Medicaid expansion, and we have the comparison group of the states that did not expand Medicaid. The study period is the 12-year period from 2008 until 2019, which kind of gives us 6 to 8 years of pre-Medicaid expansion period data, and then 4 to 6 years of post-Medicaid expansion data. We are looking at the first-time reports of individuals who were not prior victims. The reason being we are focusing on primary prevention. And we are going to limit our sample to individuals who are likely to be eligible for Medicaid expansion. So for that, we are going to use a method to limit our sample to incidents that occurred in low-income communities, which means low-income counties and high inequality counties with low-income neighborhoods. We will account for covariates like state spending on child welfare and rates of drug overdose, and we'll also account for confounding policies like the mandatory reporting policy. As a data scientist on the project, I would have loved to share some of the results from our study. However, this is a very, very recently funded project, and we are still working with these big and complex data sets, and we are at the stage of compiling all of them. So I hope that we'll be able to share some results by the next symposium. And I would like to end by saying that it is important to see that organizations like the CDC and the World Health Organization think that we can achieve the goal of prevention by making social changes. And it is important to evaluate such policies that focus on prevention of violence and would help with better understanding of the forces that are behind these kind of factors. And our hope is that our project would provide some good insight into this effort. Finally, I'd like to thank the team on this project, Dr. Letourneau, Dr. Asini Maithin, Dr. McGinty, Dr. Stewart, and our CDC team at Atlanta. Thank you.